to welcome you to our latest webinar, which is called Mining the Web, Using Useful Internet Resources on Health, Culture, and Diversity. Sorry, my tongue is a little tangled today. Brittany, let me have you move on to the next page. Let me just tell you a little bit about DiversityRx before we get started, and then I'll run through the agenda and some technical things that you need to know to make the webinar work well for you. So DiversityRx is a nonprofit organization. We've been in existence since 1997. We do policy development, research, education, and support, and our aim is to improve health care for culturally diverse populations. We have a website, which you're going to learn more about today, also a listserv called Class Talk. We sponsor a national conference series, and we just had our most recent conference in October. And for the last year, we've also done a program called Your Voice, which features webinars, communities of practice, and peer learning networks. And this webinar today is an extension of those Your Voice webinars, and we're very pleased to be able to do a new one this month. So just to remind you, Mining the Web, Useful Internet Resources on Health, Culture, and Diversity, is going to be a tour of websites that I'm going to do today along with Siobhan Champ-Blackwell, who is the Community Outreach Liaison with the National Network of Libraries of Medicine in the Mid-Continental region. And before we get started on the content, I just want to run you through a few technical things. First of all, we do have Q&A, which you are invited to submit through the question window at the bottom of your GoToWebinar control panel. You don't have to indicate a particular speaker. You can just type in your question. We will not do live audio Q&A because we have several hundred people on this webinar, and so you as an audience will be muted at all times. But you can type in your questions, and you can also use the chat window to send a message if you need to us about any technical issues. Our next slide just has a few more details about how you can ask questions. To send a question, comment, or suggest a resource to us, you can enter it into the questions pane. And we will try to answer as many questions as we can. That's not always possible because we get dozens and dozens of them. But we do keep track of all the questions that are posed, and we will try to answer them after the fact and then send you a Word file with the Q&A on it. Just one more little tip. Make sure that in the top right-hand corner where you see the GoToWebinar control panel, that if you click on View, make sure that the auto control panel is not hidden. It can hide itself from you, but if you click on the thing that says Auto Hide the Control Panel and make sure that it's actually not clicked, then you will not have your control panel disappear, and that means that the question pane will be available to you at all times. So that's our technical details. Let me just take you now to the agenda for this webinar. As I said, this is going to be a tour today, which means, unlike webinars that we've done in the past, we're not going to be showing you slides. We're actually going to be doing a live webinar tour, which means we're going to be logged into the Internet, and we're going to actually click on websites as we go along and kind of narrate them to you and tell you what we think is good about a particular website. And we'd also like to give you the opportunity to tell us about websites that you think are particularly good or you found useful in your own work. And you can also use the question panel to either type in the name of a website or to type in the URL of a website. And then we will add that to our list of hot websites for diversity, health, and culture. And that will be made available to you as a resource after the webinar is over. So that is our introduction. Just one more thing today about how we're going to do our tour. Siobhan and I are going to trade back and forth, and while I'm talking about Siobhan at this particular moment, let me just say to you that she is a tremendously knowledgeable resource when it comes to issues related to health, health literacy, cultural and linguistic competence, and a variety of other health issues with a particular emphasis on consumer information. So She's somebody who's been working with us on the Your Voice project and helping us revise our website, and she also has a variety of her own internet resources that she's put together for people. So we're very pleased to have her expertise today and very pleased to go back and forth between each other and talk about some of the websites that we think are the most useful. So let's get started. I am going to now move to the Internet Live. And I'm going to, this is going to take, now one of the things that's going to happen as we go along here is that I'm going to click on website links, and sometimes they'll come up fast and sometimes they'll come up slow. So just be patient. I will try not to talk faster than they load. And we'll start off with the DiversityRx.org website. Now, DiversityRx.org is actually a website that's been in existence since 1997. It was started with a grant from the Henry J. Kaiser Family Foundation, and it was one of the first websites devoted to linguistic and cultural competence issues in the early days of the web. It got a little clunky after 10 years, and partially that was because we were on a very old platform that we could not update very easily. And so with some support from the California Endowment, we've been able to spend the last year remaking our website, and we're very, very proud to be able to launch this new website to you because it has a lot of things on it that are far more interesting and interactive and very easily updatable than our old website. So let me just take you through this front page right here. You'll see that we have a bar across the top that has all of our tabs, all of our main subject areas. We have this nice picture window right in the middle, which has different tabs that will feature things that are new on the website or that we think are particularly important for you to see. And then you'll see as we move down the page a little bit that some of the latest information that has been posted to the website is right here on the home page. So our latest blogs are on the left-hand side, our latest resources are listed in the middle, and our events are listed on the right-hand side. And then you'll see this pretty useful window here, Get Involved, which tells you the things that you'll see on every page so that you can orient yourself to some of the most important parts of the website. So let's go straight to topics, because I think it's important for people to know what kinds of things we cover on this website, and there are quite a number of them. So I'm clicking on the All Key Topics and Issues page, and it's loading very slowly, but here you go. You'll now start to see some of the main topics that we have. Organizational cultural competence, culturally competent care. If I keep scrolling down, cultural competence training, language access issues, policy, and research. And let's go back up to the top here, because what this is basically a subject-oriented navigation to the whole website. If I click on a link here, for example, patient demographic data, that's going to take us to another page that lists all of the information that we have on our website that might be tagged as patient demographic data. So again, hang on here. My website is slowly loading here. And when we get to this page, what you're going to see is a list of resources of all different kinds. We're starting off at the top with our newest resource that's tagged patient demographic data, and it is a blog from one of our conference attendees about some topics that were raised at the conference on that subject. Now, if we go down here and we click on this particular resource, Data 2010, the Healthy People 2010 database, you're going to see what a basic resource entry looks like. So we have a big database. It has more than 250 resources in it, and if you click on any particular one, you're always going to get pretty much the same information. The title, the organization that produced it, the URL, a brief description, and then the topic areas that it's tagged under. So you'll see here, for example, organizational cultural competence, patient demographic data. You'll also see what type of resource it is, and you'll see tags that we might make up. So what I'm going to do now is take you over to the actual resource database search page, because this is going to give you a little bit more information about how you can actually look through the whole database. If you look at this box right here, search resources, you'll see that there are a number of different ways that you can look for resources on the site. There are resource types, and this drop-down menu will give you a list of all of the types of resources that we have: videos and DVDs, curricula, books, journal articles, etc. Same thing for topics, and same thing for target population. These are just some of the filters that we use to categorize all of our resources. Now, what I'm going to type in here is a keyword search, so you can see what comes up if we type in Joint Commission. And that will take us to the page that has, with good luck, all of the resources in our database that might have the word Joint Commission in them someplace, either in the description field or as the organization or elsewhere. So you'll see that there are 8 results here for Joint Commission in our database keyword search. So let me show you another important thing which we would really like you to take in mind. This website was designed to be very interactive, which is to say it's not just us and our ideas about what should be on the website, but it's also a website that we are hoping people will contribute to in a variety of different ways. And one of the ways that you can contribute to the website is to add a resource to our database. And this gives you the field that you can fill in order to suggest a database to us. You enter the title, which is the only required field, but as much information as you can add is very welcome. The organization that produced it, the author, if you have that, the publication date, the URL of the resource, and then you can write a description here. This, when you submit this form, down here at the bottom where it says Save, that will get sent to the staff. We'll have a look at it. We'll make sure that it's properly tagged and categorized, and then we will approve it for the resource database if it is appropriate to our website and the topics that we cover, and then it will be searchable by anybody who uses the website. So that's adding a resource. Now let me take you to another interesting part of our website, which is the organization directory. Basically, our database has 3 kinds of entries in it. It has resources, it has organizations, and it has people. And we'll get to the people part just shortly. But right now, let me tell you a little bit about the organization database. We think that it's really useful for people to find organizations that might have done reports, that might have be national organizations or foundations that support the needs of diverse populations. And we also think that it's important to be able to find hospitals or clinics or consultants or vendors who might be working in the field of linguistic and cultural competence. And so that's what's behind the organizational directory. You can search for organizations, again, using the same kinds of fields that you would in the resource database. And just to give you an idea of what this looks like and what it can look like, let's go to this organization down here, the Center for Healthy Families and Cultural Diversity, which is in New Jersey. And this is a really good organizational entry because it shows how well you can use all the fields that are available to you. We've got the title, we've got the description, we've got the website link, where it is, and then it's nice because you can add key resources that this organization has produced. And so it's a way of kind of letting people know not just that you're an organization, but that you've actually developed things that people might want to have a look at. So we have a couple of key resources here. And then, of course, some of the filtering information. So if you go back to the Resources tab up at the very top, you'll see not only the organization directory, but a link where you can add an organization. And that means your organization as well if you're doing work in linguistic and cultural competence and you think people should know about it. So let me move over just now to the blog page. We have 4 blogs, actually, that are part of the DiversityRx website: the Director's blog, the Question and Answer blog, the Conference blog, and then Voices from the Field. And I'm just going to give you a little glimpse of one of these blog pages. We're going to look at the Q&A, which, as you might expect, is a question that's posed by somebody, and then also the answers. And these were all taken from our Class Talk email discussion list and edited slightly. But we just find that Class Talk has such great information on it, and if you happen to miss it because you weren't there that particular day or you're not a member of Class Talk, it's still good to be able to share that with a broader audience, and so that's what we're doing in this Q&A section. So you can see here, I've got a question, a couple of questions actually, and we've got replies from people all over the country. And if you look down here at the bottom, down to the bottom, we have a comment section. And this is one of the places where people who are members of DiversityRx can actually contribute to the discussion. So we have somebody here who read our website and who sent an email to us saying that she was somebody in Miami looking for interpreters of indigenous languages and gives some contact information about how she can be reached. Obviously, you could add additional resources in addition to the ones that are already here. You could say that you think the information is good. You could offer a different opinion, but that's what the comment box is for. And while we're here, let me just point out a couple of other things to you. You'll see that we have some utilities. We've got a share box, which allows you to email this page to yourself or to somebody else. You can post it to your Facebook page. You can save it on Delicious. And there's 305 other options, which I have to admit I don't always use very many of. But in addition to the share box, you can click on this icon for a printer-friendly version. You can also click on this little envelope to use another utility to send it to a friend or send it to yourself. You can PDF the page. And if there's a problem with a page, then you can click on this link and report it to us. Now, what I'd like to do from here, because I think I mentioned that comments are something that we make available to people who are DiversityRx members, to tell you a little bit about what it means to be a DiversityRx member. So I'm going to click over here on the members area, and it tells you that anybody with an interest in cross-cultural health issues is welcome to a free membership on our website. And that means all you have to do is sign up. And the reason why we've decided to do this as a membership is because we found that it's important to know who is on the website so that if they are going to have privileges for commenting or entering a personal or professional profile, that we want to make sure that the people who are on the website are people who actually have legitimate interest in the issue. We're trying to protect our audience from spam, and as you probably know from other websites and other online forums, when you have something that's completely open to the whole world, you get a lot of inappropriate material. So there's no entry barrier here except your interest, legitimate interest in cross-cultural health issues, and I'll show you just what the process looks like. It's pretty straightforward and simple. You go to the Create a Profile page, and you have some fields, but the only required fields are your username and your email address, and your first name and last name, and then if you just go down a little bit, your interest in cross-cultural healthcare issues. So if you say, for example, I'm an interpreter services manager at a hospital in Kansas City, and I'm interested in how to assess the competency of interpreters, we'll know that you're the sort of person who should be having full access privileges to the website. So just to give you a little taste here of what you can see if you're a member, I'm going to type in a test username here and the password, and this will give me the chance to show you the member directory, which is the third piece of our resource database. Now, you can see here that when I sign in, it prompts me to create a profile. I'll show you a little bit more about profiles in just a minute, but what I'd like to do first is to, hold on just a second here. Let's go to the member directory, which is something that is only available to people if they're members of the resource, members of the website. So you're going to see here now quite a considerable list of names of people. Let's look for me because I actually went to the trouble of filling out all the fields that you can fill out in a profile. Actually, I think the best thing to do would be for me to search by keyword. So you can just type in somebody's last name to see if they're in the database, and then you can search for it, and then it will pull up that person if they are in the database. So hang on just a second. It's now loading. And if we scroll down here and click on my name, then you can see all of the different options that somebody has for building their own profile. And so the idea here is we've got contact information, we have a website, a bio, major project successes or challenges that I or my organization is working on that I'd be willing to share information about or get assistance with, useful resources and organizations that I recommend, and then some more filtering kinds of information, my areas of expertise, where I'm located, and so forth. So that's what a sample profile looks like. And we hope that it will be a very useful way for people to find an interpreter trainer or a cultural competence expert or somebody who knows something about constructing databases to collect race, ethnicity, or language data. Basically any expertise that you have that you'd like other people to know about or you'd like to be able to search for somebody with that expertise, you can do that through our members directory. So let me show you one other thing that you can do as a member on the website. There's this thing down here at the bottom right-hand corner called Your Favorites. And these are things that I have selected on the website that I want to make sure that I don't forget about. So it's kind of a filing cabinet in a way. If we go back to that page that we saw before, which is the blog on Mexican Indigenous languages, what you'll see is that, first of all, I'm going to be able to comment now because I'm a member and I'm logged in as a member. So if you go down to the bottom of the page, you'll see the Add a Comment field. And then you can say whatever you'd like to say about that particular entry. But I can also save this page where it says Add to My Favorites. And then it goes back to my list of favorites that I showed you before, View All. And you can see all of the favorite pages on the website that I've saved so that I can remember them and find them easily in the future. And there is the Mexican Indigenous Language blog entry right at the top of the page. So that is the DiversityRx website. There's a lot more on here, of course. You can see that there's an activities section and that we have an event section. But I think I've given you the highlights of the website, and what I'd like to do now is turn things over to Siobhan and let her share some of her favorite cultural competence training websites with you.
Well, thank you so much, Julia, and I am very happy to be on this presentation and just delighted with your introduction of me. So first of all, I want to make sure that you can see my screen. So
I can see your screen, Siobhan, so I'm assuming that means everybody else can too.
Okay, great.
Yes.
So I'm going to go ahead and get started. I wanted to first start off with talking about some online cultural competency training resources. And as Julia and I talked about doing this presentation, she recommended that I take a look at this resource from Dr. Olivia Carter-Pocrust, who some of you may know from her work with DiversityRx. And she had, in fact, at the latest conference, she did a pre-conference workshop. So this website, well, if you take a look at the cross-cultural clinical skills section and scroll down to the online training modules section at the bottom of the page, then you'll find some links to some resources. I'm trying to organize this so that you can go back to just a few websites to find some of these resources more easily. And I also, at the very end, I'll be talking about a blog that I keep, and I will put these links on the blog so that you can find these resources more easily. So in this online training module section, this first link she has listed, along with her colleagues, is to a physician's practical guide to cultural competent care. And in fact, that is really the Think Cultural Health website, which is put together by the Office of Minority Health. And so if you take a look at the Think Cultural Health website, you can see along the right-hand side this list of modules: physician's assistants, nurses, disaster and crisis response, language service guide, and then the small group section. Now you do have to create a profile to use these, and the one for the physician and physician assistants is actually quite complex and wants to know your physician IDs and where you practice, because there's CME attached to these. And so if you are a physician or a physician assistant, it's great for you to go in and be able to take some of this online website training. The other ones have ways to get certificates that just are certificates for participation. And so they're a little bit less complex to take a look at. I want to show you the one for healthcare language services, the implementation guide, and show you how easy once you've logged in. So I went ahead and logged in ahead of time, and I've pulled up the page, and I think that it's a little bit slow on what you can see. I'll talk a little bit about it. On the left-hand side, you can see this list of what this guide is going to look like: an introduction, patient language needs assessment, and so on. So there's all of these great resources. You take this after you've logged in. When you're done, you can either get CMEs or a certificate of participation. I also want to point out that Think Cultural Health has been involved in DiversityRx, and they recently announced in a newsletter that I just got today that they were the recipient of the 2010 eHealthcare Leadership Award. So I think that's really exciting that they've been recognized for the work that they have done with this website. I wanted to also show on this page the vignettes are really fascinating to take a look at. I'm not going to open any of them up, but I want to make sure that you take a look at them, because you can see that they are brief, 3 minutes, some of them are a little bit longer, up to 11 minutes, and they show a healthcare provider interacting with a patient or with colleagues around a topic that's of interest to working with patients who speak other languages. The next resource that I wanted to show you that comes from Dr. Pokris's website is this from the American Academy of Family Physicians, Quality Care for Diverse Population videos. And this also has a way for participants to get CME credits if you take the post-tests. But I want to show you, first of all, the videos. There's a listing, there's 5 videos, and those 5 videos are, again, brief videos that you can watch anywhere from 5 to 8 minutes to get CME credits. And just by looking at the titles of those videos, you can see one on limited English proficiency, women's health and sexual orientation, immigrant health care, cross-cultural end-of-life care. So, again, really wonderful resources for people who are concerned about this topic. The final resource that I want to point out on cultural competency training resources is the Hersa cultural competence section. Hersa is the Health Resource and Services Administration from the U.S. Department of Health and Human Services, and they have just so many resources here that it's impossible to take a look at all of them, even if we had, the whole hour just for this website. But I wanted to show you a couple of them on this page: Treating Adolescents with HIV/AIDS, Tools for Building Skills and Cultural Competence. So again, there's some training modules on that topic. There's the Georgetown University has a National Center for Cultural Competence, and they have a curriculum that's online. You can no longer get credit for it, but the curriculum is still a wonderful curriculum to take a look at. And finally, from the New York, New Jersey Public Health Training Center, this training catalog, I just found this when I was doing the research for this presentation, and really just wonderful tools on here to go in and take just again, you have to register, but once you register, you can go online and find these training modules, again, around these topics that are right on target for the information that I think is of use to people in this room. And I'm going to just take a look at this first one, Understanding Preconception Health, a course for community health workers. If you click on it, before you enroll, you can take a look at how you can get CE credits, what's the process that you have to do, and they have a link that shows sample screens. So I'm going to go ahead and jump over to the sample screens and hope that you are keeping up with me. As you look at these sample screens, you can see that they're really interesting to look at, that they're going to have a lot of great information, and what a great tool to have access to as people who are working with community health workers, or perhaps you're a community health worker yourself. So I want to go ahead now and turn this back over to Julia, because we have other things to talk about besides the cultural competency training modules.
Thanks, Siobhan. One of the great things about doing this webinar is that I'm learning about a lot of websites that I haven't seen before either, or had just never really dug into that completely. So what I'm going to do is go back and show my screen. We're going to switch screens here now so you can look at some of the tools that, two websites actually that I want to highlight to you. The first one is a website of the Agency for Healthcare Research and Quality, which is an agency of the Department of Health and Human Services, a federal health agency. And ARC does lots of things on clinical care research and quality and quality improvement. But I particularly like this site because it really focuses not so much on tools or videos or prescriptions, but it actually focuses on describing what people in real healthcare organizations have tried to do to improve the delivery of healthcare services. Now, it's not focused at all or entirely on cultural competence issues, but it has a very good set of cultural competence relevant items on here that I want to let you know about. So first of all, this is the Browse by Subject page, and I just want to point it out to you because you'll see the variety of different topics that this website covers. And what, of course, might be very relevant to us is looking for innovations by patient population. So you have here a category of race and ethnicity. You have another category of vulnerable populations, which includes illiterate, low-literate, impoverished, immigrants, non-English speaking or limited English proficiency, racial minorities, transients, and migrants. Well, you can see the whole list here, but as you can see, there's quite a number of different ways to find innovations on the target audience or subject you're looking for. Let's click actually on cultural competence here under the subject of organizational process, and this will give you a sense of what's actually here. So you'll see that there are two kinds of items on this website: innovation profiles and innovation attempts. ARC believes that it's not just the success stories that we can learn from, but also the stories where people tried to do something, but it didn't quite turn out as well as they had expected. And so that's what an innovation attempt is. But as you can see here, for cultural competence, there are 80 innovation profiles. And I'm just going to click on one so you can get a sense of the kind of depth that's included in this site. It's really quite impressive. There is a snapshot of the profile itself. And then you can see here what they did, what problems were addressed. You can see a description of the activity. If you keep going down, there's a contact information for the innovator, and then an analysis. Did it work? And it says, and down here at the bottom, there's an evidence rating, which talks a little bit about whether the evidence produced by an evaluation or some other metric actually proves to some sort of clinically verifiable kind of improvement that is useful for others. Then it goes into some details about how they constructed their innovation, which I think is very useful for people who might want to replicate this on their own. Talks about their funding sources, and then actually gives some specific information about what you need to do if you wanted to get started with something like this. You can see that there might be comments. There are some citations here. And then there's what I think is a really useful profile classification section here, which means that if I'm looking at this, I can see all of the different topics that it covers. And then if I want to, here's an interesting thing, patient use of electronic communication. I wonder what else is on this website that might be addressing that topic. And so I can click on that link, and I can go to all of the listings about patient use of electronic communication. So if we go back up here to the top, the other thing that I think is really nice about this website is that they also have some expert commentaries, which means somebody who knows something about this kind of intervention has taken a good look at it and given their analysis. And so you can also read about that as well. So there are, as I mentioned before, 80 profiles that deal with the issue of cultural competence. I think it would be well worth looking through to see if there's anything that might fit a particular challenge in your organization. I just also want to point you to the resource page, which has another bit of information that I think is quite useful, something that's been developed by ARC staff, and that's this resource right here called Will It Work Here? A Decision Maker's Guide to Adopting Innovations. And basically this is a downloadable PDF that covers the kinds of questions that you want to ask if you want to introduce an innovation into your own organization. And it sort of walks you through step-by-step different modules of the kinds of questions that you should ask. And then there's some case study reports, references, and an index of tools. So I think that this is very useful information no matter what organization or what topic you might be working on. So that's our ARC Innovations Exchange site. Now, what I'd like to do next is go to the Joint Commission website. As you may know, the Joint Commission is an agency, whoops, let's hope that it's, there we go. The Joint Commission is an agency that accredits healthcare organizations. Hospitals are one of their largest groups, but they also accredit a variety of other kinds of organizations. And over the last few years, with support from the Commonwealth Fund and from the California Endowment and others, they've really dug into the issue of hospitals, language, and culture. Partially because they know that these are issues that affect hospitals, but also because they're aware that some of their existing standards might need to address these issues of language and culture, and standards that are in development might also need to address these issues. So I'm showing you these pages with a caveat. The Joint Commission is actually going to be overhauling its website in the next couple of weeks, and the HLC project, which you're looking at right here, has actually ended, and so they're going to be doing some rearranging of their website, and some things may be in the same place and some things may be in a different place. But this week, I highly recommend that you have a look through this section of their website and take a look at all the really excellent resources they have on hospitals, language, and culture. So you can see here that if you look on HLC research projects, I highly recommend downloading this report here, Hospitals, Language, and Culture, a Snapshot of the Nation, which has not only a good overview of what hospitals around the country are doing, but also some very useful questionnaires and tools and analyses that you could possibly use in your own institution to sort of get a baseline of what might be going on and how it might compare to other hospitals. So this report is very useful, and as you can see, there's also a project update right here. Now I'm going to switch over here to patient-centered communication standards and a roadmap for hospitals. As you may know, and we actually did a webinar on this earlier in the year, the Joint Commission has just recently released new standards that address effective communication, cultural competence, and patient and family-centered care. Those standards will be going into effect over the next couple of years, but in the meantime, there is a very useful document here called Advancing Effective Communication, Cultural Competence, and Patient and Family-Centered Care, a roadmap for hospitals. And this goes through basically from the minute the patient walks in the door to the post-encounter assessment through all aspects of the organization, what a hospital needs to do in order to meet these new patient-centered communication standards. So we'll talk about the standards themselves, but we'll also give you a lot of very useful and practical information for implementation. and if you're a hospital, help you with your eventual accreditation on this. So that's the Joint Commission. Like I said, take a look at this sooner rather than later because things will be a little bit rearranged over the next couple of weeks, but definitely worth looking at. Siobhan, I'm going to turn it back over to you.
Okay, thanks, Julia. And thanks for that update on the Joint Commission, because that is a really important project. So I know that I shall be over there making sure I have everything downloaded that I want to have downloaded. I'm starting on one of the National Network of Libraries of Medicine pages. And so, as you know, I'm being upfront totally. I work for the National Network of Libraries of Medicine, so I'm doing some self-promotion here for our organization. The final thing that we wanted to talk about was how do you find information in other languages for the clients, patients that you serve. And at the National Network of Libraries of Medicine, a group of us have come together. This page has been around for a long time, and found websites that we think would be helpful to people in that quest. Now, on this page, it's a very long page with a lot of resources. And so the first thing that I want to make sure you know is that there is this search box at the very top that's a Google customized search engine. And if I were to type in, for example, diabetes Spanish and hit search, it would do a search of all of the websites that are listed on this page and come up with the results. I think that that's a useful tool, but I also think it's important to make sure that you go in and take a look at some of the pages directly, because it just shows them not in any kind of order of what's the most important, what's the most relevant. So I think it's good to also take a look at this page and find resources that you think will be most useful to you in the work that you do. I wanted to point out a few of the pages in particular, to highlight a few of those pages. And the first section that I'm going to point out is Medline Plus, the health information in multiple languages. And Medline Plus is a resource from the National Library of Medicine. I'm sure many of you already know about this resource. If you don't, please take a look at that webpage because it's so rich in the resources that it has to offer. Medical librarians at the National Library of Medicine review everything that gets added to this page. And so, in a sense, we've done the Google search for you and evaluated the information before it gets put on this website. But that's just one small piece of the whole page. It's very rich, as I said. And one of the sections we have includes this health information in multiple languages. And as I scroll down the page, you can see that there's a large number of languages that are included. If I go to the home page itself, Medline Plus also has a Spanish language portal. And so what we have done on this page is found the information that's online or that's available in Spanish. So it's not an exact mirror of the English page. Instead, it's what's out there that's available in Spanish. So Medline Plus has, again, just multiple uses in the multiple language page and Spanish itself that you can take a look at. In addition to Medline Plus, I'm sorry. I'm gonna head back to Medline Plus. Back on this page, you can see this link that's to RIN, is what it's called, Refugee Health Information Network, and that's a database that was created by, sponsored by the National Library of Medicine and subcontracted out, and state public health departments who have translated the tools and the documents that they use have this database to add the translated documents to the RIN database, and it's a searchable website that you can go ahead and take a look at. And so things like the HIPAA information, vaccines, public health kinds of information will be on the RIN database. So that's a really wonderful tool to know about. I wanted to also show you from the multiple language page, Ethnomed, which I think is a fabulous tool. It was created out of the University of Washington. And so the patients' focus on Ethnomed are the immigrants and refugees that come into the western part of the country. This is a very, again, rich resource because it has patient education information, and so information in other languages, but it also has this section on cultures. And so I'm going to take a look at the culture section. And you can see all the different cultures that are listed. I'm just going to click on the Nepali section, and in that section you can see the type of information that gets included in the profile. So the country of origin, the language information, there's a geography, the maps that are included. What are the kinds of experiences that people have had with Western medicine? So they have done a great job in building these cultural profiles as well as developing patient education tools in other languages. And I wanted to show you also from the NNLM page, the Healthy Roads Media. The thing that I love about Healthy Roads Media is besides the different languages that they have, which again there's a number of languages, you can see the material in different formats. And so if we take a look at the Spanish page, let's see if I can find it. Right here at the top, you can see that there is sound, there's text, there's web videos, but there's also the ability to download the information onto an iPod, and I think that's really cool. So if you have a clinic, you can actually have an iPod that has these resources downloaded right on that iPod, and you can hand that iPod over to a patient or a client, and they can just sit there in your office without any internet connection and listen to the kinds of information that you want them to hear. So the final thing that I want to talk about is the blog that I keep. It's bringing health information to the community. And some of you probably came to this webinar, I think probably just a few, because you heard about it on this blog. Every day, or almost every day, I try to post 3 or 4 pieces of information that I think are of interest to someone who does not work in a library or a medical library. So you can see on this page infant mortality and pregnancy loss resources, grants. There's information on HIV/AIDS, public health. So it's a very rich website or a blog. And one of the things that and I saw, Julia, that DiversityRx has the blogs and that you had the ability to share information from your website. I think that's one of the tools that we want to explore. How can I, by making this one entry on my blog, make greater use of it? And one of the things that I do with the blog is people can subscribe. So every time I make a posting, if they're a subscriber, they get an email. I don't have to do anything except hit the box that's when I make the entry that says send to subscribers. I also keep a listserv, so anyone can email me and say, I want to join your listserv. And what you'll get is I just do a copy and paste. And so tomorrow, anything that I've posted today will be on one email, and you just get one email because everybody's different. Some people want them in small chunks. Some people just say, I don't want you to have all of these different emails show up in my box. So I have that ability to have the information come in those 2 ways. There's an RSS feed. So if you want to just subscribe through your RSS feed. And then I also use what's called Hootsuite. And it's just hootsuite.com, and I post the URL to, or the information that I've posted on that website to Hootsuite, and I click Send Now, and it goes to my Twitter and Facebook page. And so some people are just following this information through Twitter or Facebook. And so through one posting, I can reach people in numerous ways, and I think that's a really great thing for us to think about how to take advantage of the technology that's out there and how can we do the work that we're doing but reach wider audiences. So I'm going to go ahead and turn it back to you, Julia.
Thanks, Siobhan. The thing that I really like about the last thing that you said is that it points us a little bit in the direction of using social media. And I think that that's something that has been a bit of a scary thing for a lot of people. I'm going to go back here now. Actually, Brittany, I'm going to ask you to just show your own screen with the sort of the home page. There we go, that thing for everybody to see. So just to finish up the point about social media, certainly we've heard that there are lots of different tools that we can use: Twitter, Facebook, mobile technology, iPods, websites, blogs, lots of different things. And actually this is a topic that Siobhan and I have been talking about for a good part of a year now. How can we introduce social media tools into the work that we do with culturally diverse populations? Because obviously e-health and m-health and Health 2.0 is a pretty hot topic for healthcare providers and developers around the country, and they're coming up with new and exciting tools every single day, from health games to messages that remind you to put your sunscreen on, sent to your mobile phone, texting, all that sort of thing. But we haven't yet seen a lot going on yet with respect to using those tools for culturally diverse populations, especially those populations that might not speak English. So Siobhan and I are going to keep talking about this, and in the future we are going to have a webinar for you that highlights some of the opportunities for using social media to reach diverse populations and shows you some examples of people who are already doing it. So that's where we're going to go in the future with this. Now, we have 5 minutes left here, but I also see that what our colleague Candace is telling us is that a lot of the questions that we've been getting are very specific kinds of questions, like, do you know a resource about this topic or that topic? And I think that perhaps the best way to handle that is for us, Siobhan and I, to take a look at those questions. And then, as I said at the beginning of the webinar, we will come up with a document that has the question and our best attempt at an answer, and we will email that out to you as a participant in the webinar. And just to wrap up, the other things that we'll be doing is we will be posting not only the recording of this webinar, which will be online in about a week, takes a little bit of time to process it, but we will also be posting all of the URLs for all of the websites that we covered in this webinar, along with some other websites that we also think are good, along with some of the websites that you have recommended to us, and that should be up on the DiversityRx website within the next day or two. So you'll get an email from us telling us with us telling you that the resources that we just mentioned are now available, and then if you have any other questions, you can always email us back, and we'll do our best to answer them. Siobhan, do you want to say anything else in closing?
Well, I did want to say that I noticed that one of the latest resources that you had listed was the Bringing Health Information to the Community blog, so thanks for that. And also then that I will be also putting the links to that information on the blog as well. So yeah, I think this has been, there's so much out there, Julia. It's overwhelming. And so to be able to go and find some key resources to get started, and that's really the thing. Just go ahead and get started. You're not going to make mistakes if you start with some of these resources that we've shown you today, because they're vetted resources. So social media is WebPoint. I saw someone said, what is Health 2.0? It's just using social media to get your information out. And the terminology that we use is scary. And when you understand what the terminology means, you realize, oh, I can do that. And so that's really important to know.
Great. Well, thank you so much, Siobhan. You are a wealth of information, and I'm glad I've had a chance to learn from you today, and hopefully we've shared the things that we like best with our audience, and we encourage you to stay in touch with either one of us. And by all means, if you've got a resource or an organization that you want to share with the rest of the world, we'd be happy to have a look at it and put it on the DiversityRx website as well. And I'm sure that Siobhan would be happy to include it in her blog.
Oh, absolutely.
So thanks very much to everybody, and thanks for joining the webinar.